Hello, I'm Dr. Brandt Gibson, and we're going to talk to you about bunions again. And we've already talked about whether you should do surgery. And as we mentioned in that video, if it's hurting and it's interfering with your life, then I do recommend that you do surgery. And what I'm going to do over the next couple of days is talk to you about what surgeries can be done. So, quick reminder, a bunion is a prominence of the first metatarsal head where the bone turns out, toe turns in, you get growth of the bone either on the side or on top that's causing pretty significant pain, pretty significant disability and problems, and you end up having to determine whether you're going to do surgery or not if it starts to limit your life. So the most common bunion surgery is called the Austin Bunionectomy, which is basically an osteotomy of the metatarsal head just behind the head, basically in the neck. So you got this prominence here, and you do a V cut. So you basically do a cut like this through the bone. And what happens is that allows you to take the head of the bone and move it over to solve the problem. So what you're doing is you're basically taking that bone, fracturing it, moving it back to allow it to heal. Then we stick a screw in it that supports it over the 4 to 6 weeks as the bone takes 6 to 8 weeks to heal. So it actually supports it, holds it in place while it's healing. And the idea, because of the way it's done, the way how stable it is, most of the time when you do this type of osteotomy or this type of surgery, you can get back to walking on it pretty quickly in a shoe or boot, and it allows you to function normally. The biggest thing you want to do after doing this type of surgery is start moving the toe, because the primary side effect of a bunion surgery is a stiff big toe, and that doesn't fix your problem. So if you have a bunion on the side, not the top, we'll talk to you about that later, but if you have a bunion on the side and you have pretty significant pain and it's interfering with life, you can do a bunionectomy through the neck of the metatarsal to move that head over and solve the problem. If the bunion is too severe, sometimes that's not an option, and we will talk about those other options, other surgeries that can be done if necessary on one of the other days. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 247, the most common surgery, the Austin Bunionectomy type surgery for bunion surgery. So a reminder, you're cutting through the bone, moving it over. We do cut off the prominence. So basically, I guess I should tell you the 3 steps. 1, you go in, you take the prominence off, you cut the bone, move it over, you stick a screw in it, and then you remove any remaining prominence from that point. So it's Dr. Brandt Gibson, and this is, again, Podiatry Tips Day 247, the common surgery for bunions.